The UK government has recently laid out an ambitious AI action plan, and part of that plan is the creation of a national data library. This library aims to use various datasets to train AI models, but one of the most sensitive datasets that might be included is NHS patient data. Now the question is, should we be concerned? Let's take a closer look at what this could mean for the future of healthcare and the security of our personal information. First off, how would you feel knowing that your health data might be used to help train AI models? Does it seem like an exciting innovation, or are you worried about the risks? The plan itself was written by tech investor Matt Clifford, and while it doesn't specifically mention health data, Prime Minister Keir Starmer has been more open about its potential use. He claims that NHS data presents a huge opportunity to improve healthcare through AI. In his view, this isn't something we should fear, but rather a chance to make breakthroughs that can benefit everyone. But there's more to it. While the possibilities are exciting, we can't ignore the fact that personal health data is highly sensitive. What are the risks involved in using this data to train AI models? We'll get to that in just a moment. Before we dive deeper, take a second to reflect. Would you be comfortable with your health information being used for AI research, even if it's anonymized? If not, why? The role of NHS data in AI development. NHS trusts have already started using patient data to develop AI models for predicting conditions like high blood pressure and even eye diseases. This could lead to better early detection and treatment. Sounds good, right? But here's the catch. The more we rely on digital data, the more vulnerable that information becomes. Recent ransomware attacks targeting NHS trusts have shown us how fragile our healthcare systems can be when faced with cyber threats. Hackers are becoming more sophisticated, and as AI continues to evolve, so do the ways in which personal data can be exploited. Anonymization, the process of removing personal details from health data, is supposed to protect individuals. But did you know that even anonymized data can sometimes be traced back to specific people? Andrew Duncan, the director of foundational AI at the UK's Alan Turing Institute, explains how a technique called re-identification can match anonymized data with other available information to identify someone. This is particularly concerning when we're dealing with something as private as health data. Imagine this: you sign an agreement with your doctor, opting out of having your data used for research. Yet your anonymized data could still potentially end up being part of AI research. How does that make you feel? Shouldn't your privacy be guaranteed? The commercial interest behind AI in healthcare. Another important question arises: what's in it for commercial companies? The UK's AI action plan suggests that public and private datasets will be used to foster innovation, especially by startups. This means private companies could access this material. While the plan emphasizes that ministers will consider public trust, national security, and data protection, the fact remains, your health data might be used for profit-making purposes. Let's not forget the infamous 2017 case where London's Royal Free Hospital handed over the personal data of 1.6 million patients to Google's iUnit, DeepMind. This was part of a trial to diagnose acute kidney injuries, and although the intentions were good, the data transfer ended up violating UK data protection law. What's stopping this from happening again? Pause for a second. Do you think private companies should have access to your health data? Or should it be reserved strictly for healthcare purposes? The potential benefits of AI in healthcare. Now let's talk about the possible benefits of using NHS data for AI development. One example given by Starmer involves AI being used in a medical emergency to pinpoint the exact location of a blood clot in a stroke victim's brain. That's incredible. In the future, AI might be able to predict and prevent strokes entirely, saving countless lives. NHS trials are already exploring how AI could be used to predict which patients are more likely to visit A&E frequently, or who is at risk of developing type 2 diabetes. This could lead to more proactive healthcare, with doctors intervening before major health issues arise. But is that worth the potential risks to patient privacy? The integration of AI in healthcare also has the potential to reduce the strain on NHS resources. With AI-driven diagnostics, hospitals could cut down on waiting times and ensure that patients receive faster and more accurate diagnoses. For instance, AI could be used to analyze medical images such as X-rays and MRIs, spotting abnormalities that might be missed by human doctors. This kind of efficiency could save lives and optimize healthcare services. The legal and ethical challenges. Let's get into the legal side of things. Anonymized data doesn't fall under the General Data Protection Regulation, GDPR, which means it's not as heavily restricted as personal data. That sounds like it would make things easier, right? But there's a big catch. Achieving full anonymization is extremely difficult. It's not just about removing names and addresses. True anonymization requires much more complex processes. And if data isn't fully anonymized, GDPR would apply, which means the NHS would need patient consent to use their data. This creates a legal gray area. Even with anonymization, the question remains, how can we be sure that patient data won't be mishandled or misused? There's also the issue of transparency. If the NHS is going to share patient data with AI developers, there needs to be a clear framework that outlines who has access to the data, how it's being used, and what safeguards are in place. The government must ensure that patients are fully informed about how their data is utilized, and there should be mechanisms for individuals to opt out without complications. What do you think? Should the legal framework be more stringent, or do you think the potential benefits of AI in healthcare outweigh the risks? Finding a balance between innovation and privacy. The UK's AI Action Plan brings a mix of transformative opportunities and critical concerns, especially in the healthcare sector. On one hand, AI's potential is undeniable. It promises earlier detection of diseases, more personalized treatment plans, and even predictive capabilities that could anticipate health conditions before they arise. These advancements could significantly improve patient outcomes and ease the burden on the NHS, making healthcare more efficient and accessible. However, the path to this promising future is not without its challenges. Central to these concerns is the use of NHS patient data to power AI systems. While data is the lifeblood of AI, its use raises serious questions about privacy, security, and ethics. How can we ensure that sensitive health information remains protected? What safeguards are in place to prevent misuse? And who truly owns and controls this data, the individual or the institution? These are pressing questions that demand clear answers. So where do we draw the line? Should we embrace AI's potential to revolutionize healthcare, even at the cost of compromising some level of privacy? Or should we adopt a more cautious approach, prioritizing data protection above all else? Striking the right balance is crucial, as both extremes could lead to significant consequences, either stalling innovation or eroding public trust. For the UK government to successfully integrate AI into healthcare while maintaining public confidence, several key steps must be taken. Transparency is paramount. Citizens need to understand how their data is being used, who has access to it, and for what purposes. Robust security measures must also be in place to prevent breaches and misuse. Finally, patient rights should remain at the forefront, ensuring that individuals have control over their personal information and the ability to opt in or out of data sharing initiatives. This conversation must be ongoing, involving policymakers, healthcare professionals, and the public. By fostering dialogue and collaboration, the UK can shape an AI-driven healthcare system that maximizes benefits while minimizing risks. What's your take? Should privacy take precedence over innovation, or can we find a middle ground? Share your thoughts in the comments, and don't forget to like, subscribe, and hit the notification bell for more engaging discussions.